Hanita, for your invitation. I'm so happy to be here again to show my experience about the company with the lens of the company. I have very good experience and thank you for stay here for listening this talk. Today I will talk about my experience also of the extend IOL and have a lot of experience with the Hanita Lenses. I started in uh, 2016 with more than 4,000 monofocal aspheric, more than 900 full range, the MF, and 1,000 and a half intensity, and also toric from 2020. And in 2022, I started to use this lens. I have just a little experience, but it was very nice experience with the extend. And today I will talk about the characteristic of the extend IOL and the preliminary results. This study is in progress. What we expect with a need of prioritize the intermediate vision, of course, and reinforce the distant vision while maintaining the correct near vision. No? But provide greater intermediate visual efficiency and traditional monofocals, but also produce less halos and light dispersion than the multifocal intraocular lenses, and have better toleration for decentration too. And extend, the main characteristic of extend. Well, the main characteristic is one-piece lens hydrophobic acrylic material, and this is the diameter 30 millimeters, and also this is the design of the optical, the smooth transition of zone between these two zones, the modify the aspheric surface to allow the extension of the depth of focus. We have the spheric version and the toric version too. And we see in the slit lamp like this bluish appearance of the lens at the bio and the slit lamps, and also like Dr. Stodulka said, that is with the blocker for UV and also the dilate filter. And it's coming in these two versions, the preloaded that I'm using actually. I have a video here and you can see how it's come the lens and how is the preloaded version of the lens, and it's very nice and very easy to inject inside of the eye. You don't touch the lens, you just put some liquid before, and after that I put viscoelastic, and I can see how the lens go into the cartridge. It's very nice injector and it's very easy to introduce. I use in this case viscoelastic because I like more to use viscoelastic for the hydrophobic lenses, but in hydrophilic I use the hydro injection. Good music, I don't know if you can listen, but well. Beautiful day. Well, I inject the lens and you can see that the lens is open slowly, but it's very safe, this injection. And I rotate a little bit, and after that I aspirate the viscoelastic, and well, you can see how is the lens. We don't see this bluish aspect that we can see in the lamp, but it's the patient say that the vision is very, very clear. This is the normal. It's not accelerated video, it's just to see how is the lens inside of the eye. I aspirate also under the lens, the viscoelastic, because it's important the right position of the lens. Okay, and this is the preliminary study results. The objective was to evaluate the efficacy of this IOL, and the method was a prospective, non-randomized, non-comparative, single-center case series study with patients with cataract, bilateral, extend lens implantation between September and November in 2022. The follow-up was just 3 months, but with the target with metropy, just plano, and study after these 3 months. A total of 12 patients, 24 eyes, 7 women, 5 men included, and this was the age average. And no patient lost any line of vision. All the patients have better visual acuity, and this was the focus curve for far, for intermediate, and for near vision. And this you can see here how is the Lockmar visual acuity of this patient for far. Very, very good vision for far, more than 0. And also for intermediate, we have in all this distance very good intermediate visual acuity. And for near vision, of course, we have less visual acuity, but the patient with the Jaeger chart, we can see that 5 patients achieved Jaeger 2 and 7 patients achieved Jaeger 3. And also you can see here in the low part, in the bottom part, how was the Lockmar visual acuity of all of these patients. To summarize, this was the first report of this lens in South America with very good performance in far vision and given very good range of extended vision at the intermediate distance. And this was the expectative that we have for this kind of IOL. You can find this publication in the highlight of ophthalmology, and I have some special video of the lady that I was operate. The first patient that I operate is with subtitles because she couldn't speak in English, but I asked how she feel, and with one eye she said that it's unbelievable. She can see very well for far, and also she can see your watch and your phone. She can read the mobile phone. And this day was the surgery for the second eye. Just with one eye was very happy. That's all, and thank you very much for your time. If you have a question.
Questions for Dr. Bianchi? Not everybody at once. Oh,
Okay.
good. Hey, I'll give her the microphone.
Oops. One for me.
Hi, I'm from Kuwait. Have you had any patients with the glares and halos? And would you recommend it? If it's not, would you recommend it for the night drivers, or you still would be cautious?
Yes. Yes, I think it's one of the big reasons to use this kind of IOL for the night driver. The patients don't care about halos; they don't mention it, and I think it's a very good option for this kind of patient. Yes, it's very, very good option. Another question? Yes.
How good is the quality for reading?
Yes. Okay. This is not IOL for reading, but it's like an EDOF. But the patient can read maybe the phone, but the computer. Yeah. Yes, yes. But it's not for reading a book or something like that. Yes. Yeah. Yes. Exactly. Excellent. Thank you for your question.
Good questions.
Very good question.
Thank you, everybody, for joining us.
Thank you very much.
Perfect.